SRL Diagnostics.
Good morning friends. Today we are going to talk about role of laboratory in the blood disorders. Today we have with us Dr. Rahul Bhargava. He is a director of hematology and bone marrow transplant at Fortis Memorial Research Institute, Gurugram. And I am Dr. Sachin Jain, additional director at SRL Lab, Gurugram. So Dr. Rahul, means when you talk about your clinical practice, so what is the role of the lab in your clinical practice of making the diagnosis of blood diseases?
Thank you, Dr. Sachin. First of all, I would like to thank you. A department of hematology can never be complete without a hematopathologist. And we are proud to have at SRL a hematopathologist who gives us a diagnosis within 24 hours and a stipulated time, by the time so that we can get the right treatment to the patient. So we all know, you come to us with symptoms. Somebody comes to us with fever, weight loss, low WBC count. What will I do? The first thing, friends, is to take a CBC, a complete blood count, and send it to the laboratory. Dr. Sachin makes a peripheral smear out of it, peeps it into the microscopes, and tells us whether there is a blast, there's a bad cells, there are malaria, there is a problem with lymphocytes, there's a virus, which helps you to make a correct diagnosis. It's a specialized, highly qualified, sophisticated lab which gives you the correct diagnosis in a limited time so that the blood cancer people can be characterized and treated accordingly. So Dr. Sachin, many people in this month being a low platelet counts, people come to you. Can you tell us when we write what is peripheral smear or what is complete hemogram, what does it mean? And is it necessary that every time pathologist has to see into the microscope to reveal the truth of a person by seeing a sample?
Yeah, so basically, Dr. Rahul, as you have asked and you have highlighted the importance of peripheral smear. So peripheral smear basically have the three important aspects. One is RBC, other is WBC and platelets. So whenever patient has come for the CBC, we have to look all the aspects irrespective of it has ordered for CBC or it has ordered for PS, and it's duty for the pathologist to give the clinician maximum information. Suppose the patient has come for anemia. So we have to find out the cause of anemia. This is iron deficiency or megaloblastic, or it is high retic count, it is hemolytic anemia or what. Parallelly, in the WBC count, if it is low, so we have to find any abnormal cells. If any abnormal cells, so that's a starting point for you to find out the diagnosis of blood cancer. Next step to do bone marrow and then flow cytometry accordingly. And last part about the platelet, because platelet has to be done manually, so it's very necessary to choose your lab correctly and follow one lab only.
So dear friends, what we have learned today is that the CBC and the peripheral smear is the gateway for early diagnosis of blood cancer. And that is what makes us very unique, to have a hematopathologist and a standard and a state-of-the-art hematology lab under one roof, giving the people the choice to make an early diagnosis and thus leading to happy outcomes. Thank you.
SRL Diagnostics.